Welcome to the Home Health Virtual Training Program, Part 1. My name is Kathy Roby, and I will be presenting Section M, Skin Condition. First, a few words about my background. I have been in home health as a clinician, a clinical manager, an administrator, and an educator. For the last 15 years, I've been a quality consultant assisting home health and hospice providers to improve the quality and the outcomes of care. Our objectives for this presentation are to describe the coding updates for Section M items and to summarize the implications of the Section M updates. The intent of the items in Section M are to assess the presence of pressure ulcers, stasis ulcers, and surgical wounds. There have been a number of changes in Section M. As a brief overview, the references to the National Pressure Ulcer Advisory Panel, NPUAP, have been updated to the National Pressure Injury Advisory Panel, NPIAP, throughout this section. A clarification of consistent data sources has been provided. Physical assessment and observation are the preferred approaches. Patient and caregiver reports or medical records, including physician or allowed practitioner orders and input, may be used. Home health providers are encouraged to refer to Appendix D of the OASIS-E manual for a description of the changes from OASIS-D to OASIS-E to ensure that you have a complete understanding of the revisions to these items. Additional changes to Section M include these. Updated response-specific instructions for the following items. M1307, the oldest stage 2 pressure ulcer that is present at discharge. M1311, the current number of unhealed pressure ulcers or injuries at each stage. M1330, does this patient have a stasis ulcer? M1340, does this patient have a surgical wound? Coding instructions have been updated. M1324, the stage of the most problematic unhealed pressure ulcer or injury that is stageable. An update to instructions for surgical wound assessment. M1342, the status of the most problematic surgical wound that is observable. This is a screenshot of M1307, the oldest stage 2 pressure ulcer that is present at discharge. For this item, we look first at the definitions to the right. Number 1 was present at the most recent SOC-ROC assessment. Number 2, developed since the most recent SOC-ROC assessment. You would enter your date in the boxes provided and select the appropriate number and place it in the code box on the left. The specific instructions for this item have been updated. We do not reverse stage pressure ulcers as a way to document healing, as it does not accurately characterize what is physiologically occurring as the ulcer heals. For example, over time, even though a stage 4 pressure ulcer has been healing and contracting so that it is less deep, wide, or long, the tissues that were lost, muscle, fat, and dermis, will never be replaced with the same type of tissue. Clinical standards require that this ulcer continue to be documented as a stage 4 pressure ulcer until it has healed or becomes unstageable. This is a screenshot of M1311, the current number of unhealed pressure ulcers or injuries at each stage. This item identifies the number of pressure ulcers or injuries at each stage, 2, 3, and 4, and designated as unstageable that are observed on assessment. This item is assessed at start of care, resumption, and discharge from the agency. Again, this is a snapshot of this assessment. It's important to read the descriptors for A through F carefully. Enter the current number of unhealed pressure ulcers or injuries at each stage in the box to the left. This is a screenshot of M1311 at discharge. Again, read the description of each item carefully and enter the current number of unhealed pressure ulcers or injuries at each stage in the box immediately to the left of that statement. What is the rationale behind the coding of this item? In M1311, it is important to recognize and evaluate each patient's risk factors for developing skin ulcers, wounds, or lesions, and to identify and evaluate all areas at risk of constant pressure. A complete assessment of the skin is essential to an effective pressure ulcer injury prevention and skin treatment program. It's imperative to determine the etiology of all wounds and lesions, as this will determine and direct the proper treatment and management of the wound. The specific response instructions for M1311 have been updated. The general standard of practice for patients starting or resuming care is that patient assessments are completed as close to the actual time of the sock rock as is possible. These instructions have been updated to allow for when the assessing clinician is unable to complete a full skin assessment at the first visit. The assessing clinician may collaborate with a second clinician who completes that first clinical assessment within the required assessment time frame. In addition, the response-specific instructions for stages 2 and 3 pressure ulcers have been updated. Please note the enhancements are highlighted in blue text. For B1, a previously closed stage 3 pressure ulcer that is currently open again should be reported as a stage 3 pressure ulcer, unless currently presenting at a higher stage or unstageable. For C1, a previously closed stage 4 pressure ulcer that is currently open again should be reported as a stage 4 pressure ulcer, unless currently unstageable. An important concept in accurately coding M1311 is understanding how to determine present at the most recent start of care or resumption of care. So let's review that definition now. Again, this content in blue has been added for clarity. If the patient has a pressure ulcer that was documented at sock rock and at discharge is documented at the same stage, it would be considered as present at the most recent sock rock, even if during the episode, the original pressure ulcer healed and reopened. Let's move on now to M1324, the stage of the most problematic unhealed pressure ulcer or injury that is stageable. This is a screenshot of this item. In the gray box, it tells us that M1324, the stage of the most problematic unhealed pressure ulcer or injury that is stageable, excludes pressure ulcer or injury that cannot be staged due to a non-removable dressing or device, coverage of the wound bed by slough and or eschar, or a deep tissue injury. Remember that stage 1 pressure injuries, although closed, intact skin, would not be considered healed. This is a screenshot of M1330. Does this patient have a stasis ulcer? This item identifies patients with ulcers caused by inadequate venous circulation in the area affected, usually the lower legs. This lesion is often associated with stasis dermatitis. For this item, you will again enter the number in the box to the left for the response that most accurately describes this patient. When coding this item, response number 3 is selected if the patient has unobservable stasis ulcers only. M1330, these are response-specific instructions. Unobservable stasis ulcers are reported stasis ulcers that cannot be observed because of a dressing or device, such as a cast or Uniboot, that cannot be removed. Information may be obtained from the physician or patient caregiver regarding the presence of a stasis ulcer underneath the cast or dressing. Unobservable stasis ulcers are defined as reported but covered by a non-removable dressing or device, such as a cast or an Uniboot. Collaboration with others is permitted. Note that if you have coded M1330 as 3, you will move directly to M1340. M1340 is, does this patient have a surgical wound? This is a screenshot of this item where we are asked to determine if there is a surgical wound. For coding this item, the response-specific instructions, does the patient have a surgical wound, have been updated. For coding this item, the agency clinician may use any skin assessment conducted during the assessment time frame. This is the screenshot for M1342, the status of the most problematic surgical wound that is observable. This item identifies the degree of healing present in the most problematic observable surgical wound. So the definition again reads, M1342 is the status of the most problematic surgical wound that is observable. Again, you will look at the definitions on the right, select 0 through 3 that most closely describes your patient, and enter the code in the box to the immediate left. M1342 speaks to the most problematic surgical wound, but most problematic is determined by the clinician's professional evaluation of the individual's overall wound status and may be based on factors including, but not limited to, healing status, such as an ulcer that is infected or resistant to treatment. Size may be the largest ulcer. Location may be difficult to access for treatment. Again, remember, this is based on the professional judgment of the assessing clinician. Surgical wounds healing by primary intention do not granulate. Therefore, the only appropriate responses are 0, newly epithelialized, or 3, not healing. A surgical incision is not automatically coded as response 3 solely due to the presence of stasis. These are important concepts regarding wound assessment that I would like to reinforce. Again, healing by primary intention does not granulate. Therefore, the only appropriate response is 0 or 3. And a surgical incision is not automatically coded as not healing if there are staples present in the wound. Surgical wounds with incisional separation will heal by secondary intention. Surgical wounds healing by secondary intention do granulate. Therefore, in addition to meeting the definition for 0, newly epithelialized, or 3, not healing, these secondary intention wounds may also fit the definitions for response 1, fully granulating, or response 2, early partial granulation, if appropriate. In conclusion, during this presentation, we have reviewed the changes to item guidance language in Section M. We have summarized the coding updates for pressure ulcers or injuries, stasis ulcers, and surgical wounds. We have covered a great deal of information in this presentation. If you would like to submit a question regarding this presentation, please send it to packtraining@econometricainc.com by August 31st, 2022. Again, that email is on this slide. As a reminder, a practice coding workshop will be held in September. We strongly encourage you to attend. Selected questions from those submitted will be answered in a Q&A session during the September 2022 virtual live event. Thank you for reviewing this presentation with us, and we look forward to your coming to the coding workshop.